This is RB. Thanks so much for joining. And my guest this evening is Dr. Robin Wiley, who is the principal of Infinity Empowerment Services. Thank you for being with me again. I really appreciate it.
Oh, of course, of course. I'm
Yes,
happy to be here.
great. So, in recognition of Mental Health Awareness Month, our talk is going to be about mental health, but is mental health a physical health issue? I've been reading some literature on the fact that there might be some shifting in how the medical and psychological fields are looking at these two illnesses and whether or not there's some relationship. But before we get there,
Hmm.
tell us just a little bit about what actually is mental health. We hear it all the time. What is mental health and what is a mental health illness?
Okay, all right. So, I mean, it's hard to sum it up into like a few concise words, but certainly I would say that mental health it's about our emotional well-being, right? So when you think about how we handle things day to day, so just to simplify it, how we strategize, how we maneuver through life, our ability to recognize our emotions, our ability to regulate our emotions, how we experience things, whether it's things from the past that
Mhm.
may still be playing a role in our life now. All of those things encompass mental health.
Okay.
Okay. It's not a, it's, I don't think, I wouldn't say mental health is a negative thing. And I think
Mm-mm.
we kind of stray away from saying, mental illness, and more so because I think historically we've always thought about like the illness part, because again, like you said, the medical field, a lot of times mental health issues were really addressed on more of a larger level within the hospital setting, within the medical field,
Mhm.
primarily by psychiatrists addressing different things that were going on. And we've had a lot of issues, I will say, historically within how certain marginalized groups have been treated when it comes to mental health concerns,
Mhm.
behaviors and things that have been what we would call pathologized,
Yes.
made into an illness, made into a disease, when
Mhm.
it was, something that was kind of a normal thing, a normal reaction to different situations that have happened in someone's life. So because of that, we kind of more talk to I think mental health has taken on more of a more of a global definition, and more of a we have more of a global perspective that everybody is responsible for, really kind of looking at mental health as a part of everyday life and a part of how we handle things,
Mhm.
and that people will have mental challenges, but that doesn't take them out of the race, so to speak. You know what I mean? Many people have anxiety. Many people are dealing with um, depression. The average person has had some type of traumatic event in their life. So all of those things encompass mental health. I know I went all around. I know
No,
I
but
went a lot of different directions there.
no, but it's good because years ago, I mean, no one really even thought about mental health. You just got up and you lived. You dealt with
Right.
issues and situations, and so we never tagged it as our whether it was good or bad mental health. But now, we've come to understand that if it's too much of anything isn't good, right?
Mm-hmm.
So when you're able to navigate and you can, address some of those issues, stress and all that, it's a good thing. And so I guess you'd say we have decent mental health because we're getting along in life
I think
well.
so. Yeah. I think the pandemic, and going through that has really helped us to have a better understanding of the importance of our mental health, because I think many people thought we were good. You know what I mean? And then you had a shutdown and people were like kind of felt more isolated into their homes. They couldn't do a lot of the things that they would normally do. And that has forever changed us. It really has. I don't think a lot of us realize that, but it has. It's forever changed us. And there are sort of markers or templates or different things that have come out of that pandemic that have shown us a lot about how mental health is that much more important. It shouldn't just be 1 month. Mental health is like an everyday, and that we have to work on our mental health consistently, the same way we would take in terms of working on our physical health. We go to the doctor on a regular basis, we get physicals, we get blood work done, and we have to really look at our mental health in the same way. Earlier, you mentioned about the medical field kind of taking more of a look at mental health. So I wanted to speak to that because something that is occurring now that should have occurred so for many, many moons ago. Medical providers like your primary care physician, your nurse practitioners, that kind of thing, even on the level of like pediatricians, are starting to ask the questions to people of like, are you sad? Do you have any things going on or whatever? Because there is a connection between mental health and physical health. Now, which comes first?
Okay.
That can be more individualized. But I'll give an example. If someone has, let's say they have, chronic rheumatoid arthritis, debilitating, that kind of thing. Mm-hmm. That can certainly lend itself to someone having emotional difficulties with that, because that's an adjustment. There may be all these types of things that are occurring in their life as a result of having that illness, that medical condition. And so that can certainly lend itself to whether it's anxiety, whether it's depression, whether it's just, increased stress, all of those things. So also our thought process about what's happening. One of my areas that I work with a lot of older adults. And so as they're adjusting to different things that are going on in their lives, that can have an emotional toll. So of course, this is not new knowledge. We know this. We do. We know that if somebody's not feeling well physically, they also might not be feeling that great emotionally. Right. The issue is that when you go to the doctor, when we've gone to our primary care physicians historically, they don't ask those questions. Right. You know what I mean? They kind of leave that for somebody else. They're like, well, what are you coming in for today? So they want you to come in and talk about your physical ailment. Right. And so when you talk about your physical ailment, they weren't asking those other questions. And it's even more important for our younger generations, our, teenagers, preteens, our younger children, because there's a lot more emotional stuff going on with those age ranges. And I mean, from elementary school on up, there's a high increase of anxiety amongst school age children. We know that they may be experiencing traumatic events, whatever those may be. And we also know a lot of times they've experienced different losses. And we still live in a society where we don't automatically send somebody to therapy when something happens. And I'm not saying we should or we shouldn't, but we sometimes don't even consider that, especially within certain cultures and that kind of thing, and ethnic groups.
Well, you raised a lot of issues because, years ago, if someone had some traumatic experience, they just buried it, and just lived on. And you're right, no one addressed the issue. Sometimes people didn't even know that they'd gone through such a traumatic issue. So here's the question. Does that, is burying a traumatic experience healthy for us? Is trying to forget about it, is that healthy? Can we expect for it to show up somewhere else? That's the first part of the question. And then the second part, what about these children who are in elementary school? What's hope for them? I mean, what hope is there if their issues aren't being addressed?
Okay, so certainly with trauma. So one of the things, there's several authors out here, and there's several books, and if you look up trauma, you can find out so much stuff about it, and anybody can kind of Google this information. But one of the things is we have to remember trauma lives in our body. Okay, so you can have and well, let me just say this first, what trauma is, because we a lot of times think trauma is what they call like big T trauma. When we think of trauma, we think of sexual, physical abuse, in neglect. We think of those types of things. And not to say that those things are not traumatic, because yes, they are. They're kind of the like obvious traumatic things. But what we don't think about is a child at age 5 falls down off their bike. And that experience for them becomes something that sort of is more meaningful to them in a way that becomes traumatic. Okay. We don't think about those types of traumas because we don't see those as traumas necessarily. And even the person experiencing it may not see it as trauma. However, trauma is about our experience of something. It's not necessarily about the event. That's why the same event could happen to two people And the way they interpret it, experience it, process it, all those things matter in terms of whether something is traumatic or not. Now, what happens with trauma is, yes, if it's not processed, if it's not addressed, does it stay with us? It does. Because what happens is I use the example of like it kind of puts a template on us. It puts like a marker in a sense. And so what happens is oftentimes later in life, many of us have different reactions to different things, or certain things may trigger us or what have you. And then what ends up happening is we don't know where that's coming from. Like, why does this situation bother me so much? But what happens is that it stirs up, it brings to the surface those feelings and those experiences you had in the past, whether it's the same event or not. Okay. So I would definitely say that, yes, no, we don't need to bury trauma. We don't need to, when something happens to us, we don't need to bury it. It is important to process it. Now, is there one way to process something? No, it isn't. But I think what happens is traditionally we think that time, because the adage, time heals all wounds.
Yes. Yes.
And in a way, maybe if you have a physical wound, yes, over time you see it heal, right? Many of us have scars on us that have a scab came over it. You don't mess with it. When your parents say don't touch it, don't mess with it or whatever. And yes, it may heal. Okay. However, sometimes we get a wound that is very deep. And so you try to do the traditional way of taking care of it. And the wound does not get better. A scab may come over it and it may look like it's healed, but there's still something going on underneath. That's how trauma works. Okay.
Okay. That's great. So go ahead. I'm enjoying this.
So I was just going to say, sometimes what happens is as we begin, and myself as a therapist, what ends up happening is when I'm working with clients, a lot of times it's those old wounds that have not completely healed that now are starting to show up in their life in a different way in terms of how they respond to things, how they react, how they experience things like with relationships, things like that. All of those things have an impact and can be impacted by our early experiences that could possibly have been traumatic. Okay. So I want to go into your second question, because a lot of the things that happen to us that sort of form us in a way do happen when we're in our early ages. They do. So when you were saying, like, is there hope for children? I mean, absolutely. I part of the work that we do in Infinity Empowers, we work with children in home, throughout a few counties in the state. And so, I certainly couldn't be in this field if I didn't believe there was hope for children. I think a part of it is that children are more aware. The younger generations are more aware of mental health. We talk about mental health more in schools. There's more social, emotional development. There's more talk about emotional intelligence, the ability to regulate and to understand our feelings. There's just more feelings conversations, period. So I think that is encouraging a generation. And, I mean, our generation, which I forget where we are, what our generation is. I think,
I don't know, but yeah, I think
I have it in my mind. I always have to look it up, like what generation am I in? But essentially, the generations that are coming after us, the people that are in like their 30s, their 20s, teenagers in school age, that kind of thing, they have more conversation about emotions. They're more aware of it. They also suffer with a lot more probably emotional difficulties too. Just because of the things that are going on. And I think their heightened awareness of feelings and emotions and stuff, as where, I know our generation didn't necessarily have those conversations a lot. We can do a lot of feelings conversations. So I think that is going to help future generations in terms of understanding the importance of emotional well-being and mental health, but also too, the access to get services, the access to talk to a counselor. It's not as, it's not taboo as it was. And to find a counselor or that looks like them, that has become a bit easier. So to access services, I mean, it's still not where it needs to be. I'll be honest, it isn't. Many therapists do not take insurance, so people have to pay out of pocket.
Which is
And when they do, yeah, and it can be expensive. It can be. And so that is hopefully something that will shift, that will make sure that people have equal access to counseling services. Because I think that can certainly be something that can be helpful, part of the interventions that they may use.
okay. So is it true then that the mental health system, I know I'm probably saying that incorrectly, is moving into schools, or are principals and healthcare providers, are they providing services in school? Is there some sort of curriculum? So how do we ask the questions early on so that we, other than a child who's acting out, how are we assessing
Right. So
any of in the
right. So I can't say that it's not where it needs to be. It definitely is not where it needs to be. I think there are certain schools, I'm sure there are certain schools where there is a social emotional component, because you got to think schools are about, the academic piece. They're about educating. So, but I think school and school officials are starting to recognize that children, based on the environment they grow up in, we don't know what they're coming in with, right? Because we can't just assume that when a child comes into school, they can just sit down at their desk and learn. Okay,
Right.
that child may be carrying the weight of the world on their shoulders, and oftentimes that's the case. So, and a lot of that is environmental, right? So, in the school setting, there is a need to be able to introduce some of those social emotional components. Teaching children about, because a lot of schools are also talking about being trauma informed, right? And
Right.
so if you're trying, because that's a big catchphrase,
Right.
and trauma informed is not just about putting that as part of your mission. Trauma informed is also about action, and that action needs to be that, yes, I may be a teacher and this is my student, but I also need to understand that if a child comes into a classroom and they have emotional stress, they have different things that are going on with them that are maybe environmental or in some kind of way, and now it's becoming internal. How much are they going to be able to process what you're trying to teach them in that day? So there
That's
is
right.
definitely a connection there, that where there may need to be time. And I've seen it, I've done some work in schools, and I've seen it. I know I have a lot of individuals in my life that are in the education system, and they will talk about incorporating things, whether it's part of a curriculum, but even just like a check-in. How is everybody doing? Like, that is significant enough, to have a child to be able to maybe open up and create space for
For
them
them.
to be able to share what's going on, or to just be able to breathe, like teaching them deep breathing techniques. It really doesn't have to be a whole lot, but it is giving children some type of space to be able to express themselves in a way that can sort of help them, to teach them a different skill to be able to regulate. Because children are going through a lot. They are. I'm not even gonna, there's a lot going on. There really
Yeah.
is.
Much more than I could even imagine, I'm
Yeah.
sure. So there are obviously a lot of undiagnosed cases where people are experiencing some sort of mental illness or some sort of anxiety,
Mm-hmm.
but they're not sure where it's coming from. So they live with this stress. Perhaps it's worry, maybe it is depression. What could they possibly do to connect this feeling that they're experiencing to something that may have happened in the past? How do they correct, realign themselves so that they figure out what could potentially be going on with me, and perhaps it is some illness that they're dealing with? At what juncture do they kind of make the connection?
Well, I don't. I mean, of course, I would say that I think people, because we were talking about insight. So when someone has insight that, okay, something's not quite right, or something is going on, or a lot of times people connect that insight or create that insight when they recognize the patterns in their behavior. Now, oftentimes, I'll be honest, this happens through therapy, because if we all could just, if we all just had insight, we were all able to say, hey, you know what, I do this because that happened to me when I was 17. You know, I mean, that would be awesome. But a lot of times we don't make those connections because we can be so far removed from those events. And we think that, again, we think that the time in between the event occurring and the present, we think that that's significant enough that things just kind of go away. We don't realize that a lot of times we've developed coping strategies that may have been adaptive at that point in time, but they're maladaptive now because we don't need to apply it to every situation because every situation is not that past situation. So, I mean, I definitely would say that I think if people don't always connect their behavior to past trauma. And I'm not saying it always is about that. Excuse me, it isn't, not necessarily. But if it is, oftentimes there is just a need to be able to process it, because sometimes things have happened in our lives that we've never really talked about, or we haven't really spent the time and effort in really processing it. And processing is talking, sometimes figuring out, like, you know, what the narrative is that we've attached to that event, you know, how we interpreted the event, maybe kind of a lot of times unpacking it a little bit. And so you have to be ready for that also. You know, it's not like I can say, well, hey, you know what? Let's talk about your traumatic events that have happened, and we're just going to unpack them right now. Sometimes we're not ready. We're not ready for that. And oftentimes when people experience a traumatic event, they're not ready at that time. And sometimes that can be hard for folks to understand, or for like the parents of children to understand that, you know, we talk about, because here's the other piece about the body. Our mind will protect us. So that's why sometimes we repress something. You know, we don't recall all the specifics of what has happened. So as a result, and that's just a protective factor. It is, but a good protective factor, because we can't handle it. Okay. That's why when people will talk about sometimes dealing with like abusive situations or whatever, they will say kind of like almost like going outside of their body, or not remembering things, or just kind of like blanking out everything. Like, you know, so that's all of the mind's way of protecting us. And I'm saying that, you know, very loosely, the mind's way of protecting us from the event that's happening. Now, when we get older, though, because a lot of times we create coping strategies that relate to those events. But that's where the thing comes in, is when the issue can come in, is that we continue with those same coping strategies. Because, you know, when something happens to us that's traumatic, oftentimes it puts us in a position where we question the people that care about us. We don't trust people. We find this need to protect ourselves at all costs. And in those situations, that may have been the case, but it is really about what we bring into the present, what's going on with us now. And that could be, you know, 10, 15, 20, 30 years later. And, you know, we still don't trust people. We haven't, you know, so we don't open up to folks. We won't even allow we won't allow people to be in our lives, or we treat people a certain way because we're still trying to protect ourselves.
Right. And it's difficult because, you know, sometimes you meet with people and you know that there's something that's going on with them. But if they're not ready to acknowledge it, it's really difficult.
But they may not even make the connection. That's why I'm saying sometimes you need somebody that's a neutral person to sort of ask those questions, to say, hey, you know, have you noticed, you know, this is something that you're saying you're doing or you want to deal with, but do you understand like where that may have come from? And that's a lot of times when you meet with a therapist will kind of get more of your history. They'll ask different questions. Because not to say that everybody's stuff is coming from the past, but I think it's safe to say a vast majority of folks, all of us, you know, we've had experiences that just, I mean, even if it's a good thing, like it could be anything, you know, that you experienced as a kid, and you're like, yeah, this is just how I've chosen to live my life because that's what I experienced as a kid, and that has set the stage for how I'm going to live life,
right?
Whether it's adaptive or what have you.
Right, and that's the sad part of the story, because we are cheating ourselves out of living a more fulfilling life and not even aware of it.
We can be, right.
Yeah, not even aware of it because of these coping mechanisms. You know, and sometimes people say, well, you know, this is just the way I am. Well, that's true. But you know what? Maybe if we peel some of the skin away from that, off of that, you might be able to see that it's really not just the way you are. Might be something
And
else.
right. And I mean, it's also, you have to think, like, if it's, how's it helping you to function? Like, what function does it have in your life? So I always, when I think about behaviors that people may have or exhibit, it's like, okay, if it works for you, that's one thing. But a lot of times people are not really satisfied with life, and they're not satisfied with the outcomes. And so you have to think, like, what are you putting out there? What are you receiving, and what are you putting out there? So if you want a more fulfilling life, but you're not going to let people in, then is that what you want, or is that not what you want? You know what I mean? So I think we definitely have to, think about, I think what happens is, the older we get, we think like, this is who I am, I don't need to change. Okay. But if we're really taking a self-assessment, if we're really taking a look at ourselves, and I think that's important at any age that you're at, is to just take a look. I think when we're younger, we might do that a little bit more, but as we get older, we don't really start to say like, hey, you know what, where am I at in life? Where am I at in particular areas of my life? How do I feel about myself? I'm not talking about what you can take into consideration, but I'm not talking about what somebody is telling you about yourself. Sometimes though, that's an indicator. If everybody's saying the same thing, we might need to take a look at it. And sometimes that promotes that. However, it's always great to do like a check-in, like to just say, well, where do I feel like I am? Like, what's going on? Are there some things I need to work on? Because that creates self-awareness. Right. And that self-awareness is so important, because if we're just walking through life thinking that we got it together, okay, and I'm not saying that you may not, you may have it together, but there's always something maybe that, we may need to take another look at. And sometimes, there can be the benefit of that, because it helps you to grow. We don't stop growing, exactly. But I think we have to have that insight, because things change. So the thing is, we don't stop growing because there are different things that occur in our life that affect us. There could be things that are happening now. I think this whole thing out of like women of a certain age, you know what I mean? And when you get to that certain age, there's all kinds of things that you have to adjust to. Men of a certain age, different things they have to adjust to. We can't continuously be the same person decade after decade. And maybe people may not agree with me on that, but there's some things, like when you're 20, there's some things you can take with you into your 30s and 40s, but there's other stuff you can't. Right. It's not going to suit you. It's not going to bode well. It's not going to help you. So that insight that we need to have, and sometimes that insight comes from recognizing these behaviors that I exhibit don't work for me anymore. Mm-hmm. So what do I need to do to change these behaviors, or do something differently, or, recognize how things, like whatever it is, but right. That's growth. That's just growth. And it's okay. It's okay. I'm not saying it's easy. Don't get me wrong. I'm not saying this is easy to change something you've always done, but if it's going to help you to be better and help you to kind of live differently, really kind of embrace your better emotional well-being, then it'll be worth it.
Right. So self-awareness, I mean, that's so key. And we hear about that all the time. And you mentioned earlier, emotional intelligence. And, for me, it just means, when it just individually, for me, it is self-awareness, being able to understand who you are in this world, how you fit in, and how you relate to other people. And I mean, it's nothing more than also a biblical principle, to love your neighbor as yourself. And, so it kind of all washes and works together. But if you're not open to understanding the implications of what it means to be self-aware, or to love your neighbor as yourself, if you're not open to that, then you are depriving yourself of some pretty good things that might be out there, because there are relationships with people, there are groups of people, there's networking, there's so many opportunities. But if you've closed yourself off to them, you really have shortchanged yourself. And I can't even tell you the number of people that I've met over the last 5 years that are so afraid they're so fearful of doing new things, and these aren't even women of a certain age, and so it's a concern that, they really aren't blossoming the way they should, because they've let the past
Right.
uh,
Yeah,
dictate.
hold them back. It can stagnate us. It can really hold us back. Yeah, but I think it also can be scary work, because what happens is that you think something is done. You think, okay, I experienced that, so it's over. I don't have to deal with that anymore. I think our fear kicks in, with the feel, because we can be fearful of the feelings that it will dredge up, not realizing that it's still lingering. You know what I mean? You just don't think it is, but it's still lingering in your life because it's holding you back from doing some things. So I say, a lot of times that's where talking to a therapist can really help you to navigate those waters at a pace that is suitable for the individual. Because what ends up happening is you don't necessarily want to act like it doesn't happen. You know what I mean? You don't want to act like, oh, this didn't happen to me. This was not a big deal for me, because that's kind of getting more into denial, which I don't think people normally deny trauma has happened. I think just they think, okay, it happened like 20 years ago, so how could that still be impacting me today?
Exactly. And I think that's why it's so important, I think, to be aware of
Mm-hmm.
your behavior, your actions, the patterns, because if you notice a pattern or a cycle, right, then you've
Mm-hmm.
got to ask yourself, well, why do I keep coming back to this place
Right.
again? Why do I keep finding myself in the same predicament? Why am I shutting myself off every time I meet someone new?
Mm-hmm.
The pattern, the cycle is what should drive people to try to figure out what's going on.
It
Um,
should. Yeah, it should. But sometimes it's also like you also sometimes need somebody to point out the patterns to you, because people don't, because we get comfortable in the behavior that we've always done, so we don't always recognize the patterns.
that's
We
true.
don't always, yeah, we don't, and that's a self-awareness
That's true.
thing too. I mean, we don't always recognize, like, wait a minute, I think when somebody helps you to kind of tease it out, be like, oh, you seem to be doing this a lot, then we're like, oh yeah, that's right, now I get it. But
Yeah.
yeah, sometimes we don't recognize that, because again, we're going through life. So when you're going through life, um oftentimes we convince ourselves of things that we need that aren't good for us.
Mm-hmm.
We don't always acknowledge the behaviors that we have that don't work for us. You know what I mean? We'll just keep doing the same thing, and not realizing we're not getting the outcome that we want, but we just keep doing the same behavior. And so that's just, again, that insightfulness, and sometimes it's habit. If something that you've just done for the longest time, you just it's a habit, and you just don't realize, like, okay, I just do this because it's just the norm to me. Not recognize, and sometimes doing the opposite of that can be more stressful, and
Yes.
a person can have more fear about what the change may be.
Mm-hmm.
Because that change behavior can be really tough, because it's like, oh, wait a minute, I gotta do something different. I don't know, that's not comfortable for me because I'm used to doing this other thing.
Right. Yeah. Now, let me ask you. Now we're talking mental illness. So someone has been diagnosed,
Mm-hmm.
and the question is, can they simply decide to get over it, to work to get over it, or is it of a chronic nature, such as someone who may have a physical or mental illness, such as diabetes? So when we talk about mental and physical chronic illness, can they be treated? Or is it just something that someone has to live with for the rest of their life? So if you've been diagnosed as having some mental illness, do you have to continue to live with it, just as someone who may have chronic diabetes?
Well, I think we don't want to necessarily put, like, when someone has like a mental challenge or any kind of concern like that, we don't want to put it in like one box, because there is really more of a spectrum of different things that can go on with somebody. Someone could experience something and have more of like a difficulty adjusting to something, and then as a result, they have an emotional response. They might have increased anxiety. Like, let's say, someone gets into some type of accident or something, and as a result of that, they have some increased worry, some anxiety about being in that same situation again. That anxiety could increase, and it could become more so where it kind of keeps them from doing some different things that they would normally do. So that's one level. And then you have where folks may have, something that is more of a chemical imbalance, where they may have like more of a major depressive disorder or something like that, or a bipolar diagnosis, or have something more schizophrenia, that kind of thing. There are certain type of mental concerns that run in families. A lot of times we get family history. There's things that have kind of been, there's some genetic connections. So there is a range of things. So I think it's kind of on an individual basis. Now, in terms of curing and that kind of thing, it really just depends on what it is. Some people do, like, it's just like if you suffer a loss, like you're dealing with grief, then, it's expected that you're going to have some type of emotional response to that. People can become depressed. People may have some increased worry. There may be all this kind of stuff that's going on. And they may even have to seek out medication, that type of thing. It doesn't mean that they're going to be on it forever. So it's no way to really say like, okay, yes, this is something you're going to have for the rest of your life. It may not necessarily be the case. It could go either way. Somebody could be dealing with grief. The depression could stay with them. It could, because it's all depending on the nature of the loss, how they interpret the loss. There's so many factors there. Okay. But they could also deal with their grief and then eventually go back to their normal way of living, and maybe they don't need medication anymore or anything like that. Same thing with anxiety. There's events that happen that cause people to have increased anxiety at different times. So it's no real easy way to answer that question. I mean, I think what happens is that people live with mental challenges. That's what I think. I think people can strive and they can make a way for themselves despite that they may have some concerns that deal with mental health. I think plenty of people are doing that. You have people that, and we see that more now because we have this, there's a lot of literature out there about people who are, high functioning folks with anxiety, with depression, because we also, and I think specifically in the African-American community, we do not always talk about what is going on with us, and we can have this mentality of sort of pushing through and, just pushing through despite everything that's going on, and that comes from a lot of places. I think that also comes from some of our, genetic markers in terms of, our heritage, ancestral heritage in terms of coming from slavery and that kind of thing. You think about the trauma of different events, things that happened during the time of slavery to people. And the fact that you didn't have time to express any emotions. You had to go back out there and do what you had to do, regardless of whether your child was taken, regardless of whether your husband was taken, you were, somebody were beaten, whatever the case may be. So we carry a lot of that with us. We do, and there's a lot of information out there related to that. So we have this kind of mentality of like not necessarily expressing the emotional connections that we have with certain things that happen. So we could be depressed, still going to work every day, still taking care of everybody else, and come home and the only thing we can do is go to bed. I also think there is certainly a lot of conversation now about Black men in particular with depression and how they don't talk about it. They don't necessarily, they may not even experience it the same way because a lot of times it's showing in different things, and so we have to start looking at mental health in a different way. We have to start looking at like everybody that's depressed is not going to be just in the bed all day. Everybody that's anxious is not going to be jittery. People express anxiety in different ways. And we have to start looking at that. And I'm saying we, because we as support people, as friends, as family members, but also as professionals, we have to start asking different questions, and especially in the medical profession, because oftentimes when someone is going to talk about what's going on with them emotionally, if they're asked that question by a medical professional, they're probably going to share that information. And so our medical professionals need to start asking those questions differently, and asking people how they're functioning, because what happens is that, like I said, people going to work every day, but it's like, well, what other activities are you doing? You know what I mean? Are you coming home? Are you sleeping a lot? Are you still doing everything? And a lot of times we just don't have time to feel. Right. If you got people out here that are caregivers that are and caregiver for everybody, and just don't have time to really even acknowledge what's happening with them inside until it's like to the point where they have to. Right. They don't have a choice.
So if someone is ill, and we said earlier that it might really wear on their emotional or their mental health. Is there any way to bifurcate that so that you can deal with the illness and it not impact you, your mental health? Is that possible? Has it been done? Um, is it something we can expect, or is there such a thin line that either the mental illness or mental challenge is going to impact the physical and vice versa?
I mean, I think it's kind of on an individual basis, honestly, but I think it's hard to be going through something that is physically a physical illness. And because you can't say that you won't have an emotional response to it. I think it's almost impossible to be going through a physical challenge and not have some kind of mental health concern that's related, because we have feelings. We're human. We have that ability to feel. And so which is great, right? But it is also, I think, a lot of times we just don't acknowledge the emotional toll something can be taking on us. And that could be something negative, but it could also be something positive. You can have great stuff that's going on in your life and it can still be overwhelming. So I think oftentimes we're not looking at the emotional responses. We're not necessarily acknowledging what our feelings are. We're not acknowledging what our thoughts are related to a situation. And so I think all of that just kind of impacts us as a whole. So I don't think it's possible to go through a major medical issue and there to be no emotional response to it whatsoever. I don't think that's I don't think anybody is, because I think, we'd be robots. You know what I mean? It's like you're separating the two. I don't think we can separate the two. Now, do I feel like we can work through those things? Yes, I absolutely feel like you can work through them. But I think to say that, okay, you can have a physical issue and have no mental health concern, no, I don't think that's possible.
Well, the reason I asked the question is because if you are having some physical illness, I think that unless you acknowledge that it is wearing on you emotionally or mentally, if you don't acknowledge that, it could become even more detrimental physically.
Yes, yeah, you can't, right? Because it's
acknowledging that, you know what, I am real. So I take, for example, cancer. Someone who's going through radiation or chemotherapy, and it's something that you have to do, and you prepare yourself mentally for it. And you decide that I'm going to beat it, and everyone around you is for you. But unless you recognize that, this is really hard, and there's someone you can talk to about that. And cancer is probably a real exaggerated case, but unless there's someone that you can talk to about the challenges, how every day is going, you might find yourself worn even more so, unless you can vent, unless you can talk to someone about what you're going through emotionally. Because see, I think most people know, yes, it's tough, you're sick, but they don't connect that to how it affects you mentally. That connection is so key.
And that can be the most uncomfortable part too, because oftentimes people just are not comfortable, especially folks of certain generations, certain cultures. They're not necessarily comfortable talking about the feelings that are connected with the tangible, so to speak. So yes, you're dealing with a major, medical situation, cancer, something like that, where, yeah, it is going to be hard, but to be able to connect the feelings and to be able to verbalize that can really be a struggle for folks, for some, not for everyone, but for some. And I think the other thing too is about the mindset. That's a bigger part of this too, because our emotional piece impacts our mindset and vice versa. You know what I mean? Like if you feel down and sad and that kind of thing, then it's very hard to have a mindset of victory, of recovery, of all those types of things. It can be tough. And sometimes we look for people outside of us to give us that, and they can contribute to that. But honestly, that has to a lot of times come from within, that motivation, that idea of trying to change a narrative that we've created for ourselves that sounds that is not positive in any way.
Mm-hmm. I get that. Now, one other point I wanted to touch on was you mentioned in uh, the male population, many of them are going through depression, and they may not realize that's what's happening.
Mm-hmm.
Can you talk a little bit more about that, about what some of the signs might be, how they may be interacting with family members, just so that they can try to hone in on, this is something that I'm dealing with. I'm not just worried. And I perhaps I should talk to someone, and that someone may be a pastor or a fraternity brother, someone outside of themselves.
So one of the things I want to say, because I know our audience, I'm assuming there's going to be some men in our audience. So I'm going to say some things. I don't know how they're going to hit, but I'm just going to I can only be honest in terms of what I see professionally, so one of the things, let's take a minute and let's talk about how men and women are oriented in this world very differently, right? Mm-hmm. So women, we know we're oriented in this world, we can cry, we can express our feelings from baby on up, no problem. All right, no issue whatsoever. Which is why we're more comfortable with emotions. We're more comfortable expressing that. We can say I'm sad, whatever. We can do all of that. No one is going to think anything of us. How do we orient boys into this world? We orient boys by starting out with saying, if they cry, what you crying for? You don't need to cry. There's nothing to cry about. Don't cry. Mm-hmm. Boys don't cry. We say all those and I'm saying we, because it's other men that say that and it's women that say that.
Sure.
Okay. And what is the first thing, because any of us who have done couples counseling, what is the first thing that a woman is talking about yep. her, if she's in a, traditional relationship, whatever, with her male spouse or boyfriend or whatever, what is the first thing she will say? He doesn't talk about his feelings. Mm-hmm. He does not acknowledge his emotions. He's emotionally unavailable. That's a big catchphrase that we talk about now. And not recognizing that, men are just oriented very differently. So they start out with this idea that there's no space for you to be vulnerable and show your feelings. So it's not that they don't show feelings, but they have to show the power emotions.
Right.
So one of the major power emotions is anger. To me, anger is and anger is such an umbrella emotion. And what I mean by that is it covers up the other emotions that somebody might be feeling. Because when you're angry, it pushes people away from you. People will get away from you. People will, they may even respect you more. They will, it pushes people away. It gives you the space that you may need, but it's also a safe emotion to show for men. Because nobody's going to say, for lack of a better way of saying, nobody's going to say you're a punk if you are angry. Mm-hmm. Mm. So I say all that to say that, and there's more information that has come out. Like there's there's famous people who, there's some books out. There's different people that are talking about like how men, what they are experiencing. And I'm not saying that, okay, men are just inherently depressed. I'm not saying that, but their experiences, like Black men in general, okay, our Black men are hunted, okay? They are hated, they are hunted, they are seen as a threat when they are none of the above, okay?
Yes.
So as a Black woman, I cannot imagine what it is like to walk through this life as a Black man. Mm-hmm. I don't know. I only have a snippet of what that might mean.
Sure.
Right. So if you think about that, the experiences that Black men have, would it just not just make sense that they would be under a lot of stress, sure, have some anxiety, feel maybe some sadness, feeling overwhelmed with all of those things? Mm-hmm. It makes sense, right? It does.
And we haven't even talked about work.
Right. We haven't even talked about work. Right. We're
Right.
just talking about just getting up and walking outside to your
Mhm.
car and driving your car somewhere as a Black man. You know,
Mhm.
and so to me, the idea that what do they do with all that? Like, what do they do with all those emotions and feelings? Because it's also not always safe to express all those feelings and emotions. It
Mhm.
might not even be safe for them to express those feelings and emotions within their own household
It's true.
because we as women may not allow the space for
Mm.
our male counterparts to
Mhm.
express that, right? We may not, because the thing is, if I'm, seeing you crying every day, huh? Like what's going on? Right, because of how we have just made it so that that can't happen. That's not okay.
Right, but
So
you know what? I think that there are some women though who would be okay because they would say to themselves, "Well, finally,
well,
finally,
yeah, oh yeah,
this
there
moment,"
are some.
and
I don't think
be
it's the majority, but there
ready
are
and prepared, to listen. But go ahead. Yeah.
right, but it's also too, I think, men's perception. Because if you're a man, are you perceiving that it's okay for you to express this level of emotion and maintain your masculinity, maintain, your image, how you want to be perceived, whether it's within society, whether it's within your family unit, in the environment, what have you? Is that okay? And if it's something that you haven't done for the majority of your life, then is it okay for you to start doing that at this particular time in your life? So I do feel like that, there are a lot of emotional things that men deal with and that it can be masked. And I'm not saying, when I say anger, and frustration and that kind of thing, I'm certainly not saying that, okay, all men out here are angry and that type of thing. I'm not saying that. I mean, anger is an emotion that sometimes it is appropriate. But we do see a lot of younger men, you know what I mean? Younger individuals, young Black men in particular, that are expressing behaviors that are indicative of anger, that they don't know what to do with their frustration, don't know what to do with feeling overwhelmed, don't know what to do with feeling anxious or worried, whatever that's about. And we're not always necessarily creating space for them to be able to express that. And so I do feel like there is a high, and one of these, because you were asking me like symptoms, and that's why I was saying like in terms of how they express emotions, that kind of thing. But sometimes the way that we would think that someone would express depression or how the symptoms of depression are not necessarily going to look the same, because with a young man or what have you, theirs may be coming in destructive behavior. It may be behavior where there is a lack of concern for life. There is a pretty significant suicide rate amongst African Americans, whether it's suicide by like what we would normally think of in terms of somebody trying to commit suicide, or whether it's suicide by lifestyle choices.
Mhm.
So there's a lot of things to take a look at. And there's also a high prevalence of suicide amongst professional women of color. And that's something else we have not, we're not, they're starting to look at that a little bit more, but I think, folks are overwhelmed. Folks can be overwhelmed. And oftentimes when you're achieving and you're doing, nobody thinks that you're going through anything. And the
That's
person themselves may not think that they're going through anything.
right. Until one day, it's just too much.
Right.
And I asked the question because, when everything that we are experiencing that's of a negative nature is balled up inside of us, we can expect that it might translate to some sort of illness, to a stroke, to a heart attack, those types of things. And so you want for them to have some sort of outlet so that they can live as long as they can and not have so much bottled up inside of them. So if they were able to see, some symptoms, or perhaps the spouse saw some symptoms, maybe that would be beneficial. But for sure, we can't keep it bottled up. We've got to be able to
No.
release it in a way that isn't going to push people away.
Right. You got to have, I think it's important to have an outlet. It's important to have
Yeah.
some coping strategies that work for you as an individual. So whatever that is, it could be sports, it could be taking a nap, it could be journaling, it could be some of the things that maybe a therapist would recommend in terms of, deep breathing exercises, sometimes getting out into nature. But I think, there is a need to do that. And we all have to have that. Like, that's not just, for someone who might be diagnosed, but we know there are a lot of people that are walking around that have undiagnosed mental health stuff, and we see that play out in terms of how they may interact, how they interact with the world, because it can be stressful. And people can be fearful. They can be fearful of being labeled. They can be fearful of, okay, somebody's gonna try to put me on medication. But they can also be fearful of talking about the stuff that they haven't talked about, peeling back those layers. That can be very difficult for folks if they feel they're not ready. And so I do feel like it's important to have some types of strategies, whatever you're doing, because the smallest thing, we have a natural regulator within us, our breath. Our breath, taking a breath, which we do without thinking about it, right? But taking a deep breath and letting it out slowly, that is our body's way to regulate us. And many of us, we don't take the time to do that. We don't take deep breaths. We just breathe. We just, we're like, I'm breathing. That's it. Why do I have to take a deep breath? You know what I mean? And it's not as easy as you think if you haven't practiced it. Also mindfulness is another strategy, that we really, we think, oh, mindfulness, what is this mess? Right. But mindfulness is really like being in the present, but it's also about an awareness. Okay. It's an awareness of thought. It's not about being absent of thought. It isn't. So I'm not talking about like sitting and, chanting and being, in a, like meditating. It can evolve into that, but it doesn't have to be that. Most of the time where we are is not where we are. Okay. So what I mean by that is we're here in this meeting, but we may be thinking about what you got to do tomorrow, what I got to do after this conversation. I might be looking across the room at something. It's very easy for us to get distracted into another area of life or what have you. So mindfulness, practicing it, and oftentimes it has to do with the senses. So I always tell people, sit outside, like just sit outside for a few minutes in the morning, after, whenever, and just take a moment to listen to the sounds that are happening around you. That's mindfulness. That's it. That's it. And a lot of times, do it for 30 seconds. You build up your mindfulness skills. And what mindfulness does is it gives us a sense of awareness. So it allows us to recognize when we have thoughts creeping in, okay, that have nothing to do. And it also allows us to be able to experience life in a different way. Because now when I'm sitting down and I'm talking to you, I am totally present with you. And so that allows me to enjoy that experience with you. Versus I'm here, but I'm on my phone. I'm doing this. I'm doing some other things. I'm thinking about whatever, all the other stuff I got to do. I'm worried about stuff. That takes us away from the present moment. And it's amazing because I'll tell you, the most mindful people can be people that are much older in age. Like as we get older, like, your folks that are like your, octogenarians, your centurions, your, folks that are like 85, 80, 90, 100 years old. Those are people that are in the moment.
Right. Okay.
And unfortunately, we know why that is, right? Because as we get older, when you're 100, every day, you wake up, every day you're like, I'm awake, I'm alive, like this is great. Yes. And so there's a gratefulness piece there. But what we need to recognize is we don't need to wait until we get 100 to appreciate waking up every day.
Right.
Or being in the moment or enjoying each experience.
Exactly.
So that's certainly, and that contributes to our better mental health. It does. Yes. That contributes to our emotional well-being, being in the present. And I'm not saying it's easy. Don't get me wrong. I do not have, this is not a skill that I've perfected. No. I work on this too. But it's important for us to develop that skill because it definitely helps us to experience and embrace life in a different way.
Yeah. Well, I think this is a great way to end our talk. Right. Talking about being mindful. And, when you said the word, I thought clarity, cleansing, yes. Sometimes taking a few moments to not think of anything except your surroundings and taking that really does bring things into perspective. So, and thanks for explaining that. I mean, I've heard it quite often, but you've, really put a great definition behind the word. So thank you. Thank you so much. Before we go, though, is there one last comment you'd like to make to our audience about their mental health?
Well, I think I'd just like to say that, making sure we understand that mental health is a journey, like the journey to emotional well-being. It's a journey. So it's not that you do one thing today and then that's it. You know what I mean? You're good. I think we have to, assess ourselves. We have to take a look. We have to create that self-awareness, but understanding that, sometimes it does require us to peel back some layers, have some difficult conversations. All that's okay. You have to be patient with yourself, understand that it's important. This is about you. This is about the long haul. This is the long game. Okay. And, taking some time to acknowledge what we might be going through from a mental standpoint, how that might be affecting us physically, or how the physical may be affecting us mentally, is all a part of this journey that we're all on.
Okay, no one's exempt. Great,
No.
great. Thank you so much for being with me. This is Arby's Kitchen Talk, where the heart touches the soul. Thanks, and I'll talk to you soon.
Thank you.
All right, bye-bye.